Mi nombre es Álvaro Figueroa y voy a ser el moderador de esta sesión en el tópico de la dentición mixta. Y vamos a hablar de anomalías orales y aspectos oclusales y también aspectos quirúrgicos del injerto óseo alveolar. La primera presentadora de este día será la doctora Rosa Helena Lacerda. Ella va a hablar de las perspectivas dentales. Ella viene de la Universidad Federal de Paraíba, el Instituto de Fisurados de Paraíba, Brasil. Rosa Helena.
Gracias, buenos días a todos. Yo voy a hablar en inglés porque mi español is very bad, okay? Good morning, it's a pleasure to stay here today. In the first Smile Training, Innovation and Training, it's a pleasure to be part of this history. And I'd like to thanks to Dr. Flores to make me be part of this, and to all the Smile Train partners to stay here, wake up at 8 morning to stay here. I hope you enjoy. We'll talk about some points in a dental perspective about the mixed dentition. I'd like to thank again to Smile Train to consider my name to Brazilian Medical Advisory Board. And I'd like to thank all my patients and my cleft center because it's a pleasure to treat, and we are here to improve our quality, and I hope I could add anything for everyone too. So regarding mixed dentition in a dental perspective, we have to think that it's a very important phase because it's a transition phase in the human dentition. And regarding the cleft palate patients, we have some details that are very important because in this moment is the moment that we need to see what's happening in the first steps of the treatment. So we need to stop and to check. What will happen, and then is a very important phase to treat these children. What happened regarding the first steps? We are talking about the treatment protocols. So we have many studies and multi-center studies around the world trying to find best practices. And it's very important to analyze these in this moment. And what we find in the scientific evidence is that not only the protocols, the surgical protocols, but the surgeon. And we need the well-trained surgeons. And I congratulate the Smile Train for the initiative to training the surgeons too, because they are a very important part of the good outcomes. But not only these, we need to understand what will happen. And then it's important to understand what will happen. It's important to analyze the babies and to analyze what is going on, what is happening in these phases in maxillomandibular relationship. And for this, it's well known that we have the yardsticks, Goslon yardsticks for unilateral cleft lip and palate that consider transversal, vertical, and most important, anteroposterior measures, and we need to analyze. And this will tell us about the anteroposterior and the prognosis. Patients that in the mixed dentition have Goslon 1 will have a good prognosis of maxillofacial growth. And patients that have 5 will need orthodontic surgery. And the bilateral cleft lip implant, the same way we have bilateral yardsticks. And this was developed by Dr. Terum and her team, and they improved and planned it for 6 years, 9 years, and 12. So we need to remember that it's important to well documentate our cleft patients because we need to understand what will happen. And the mixed dentition is a very important phase to do it. But not only this, we need to pay attention that we have clinical signs. We need to pay attention in all the details and all of the teeth wants to tell in us. And for this, we need to take in good photographs to have clinical examination, to analyze carefully all of the images, radiographic images. And if we pay attention for all the details, we'll find many very important things to analyze. Look at this pen and we will check that we have an agenesis of premolar. It's important to analyze not only the dental agenesis and the cleft area, because we have scientific evidence that hypodontia or maxillary dental agenesis is correlated towards prognosis. And more recently, in 2021, the scan cleft telling us that patients that have hypodontia of 2 or more teeth in maxillary arc, they have worse prognosis, or they have more chance to develop worse prognosis. So in this line, we developed a study in these last years that we analyzed many others dental anomalies, not only the tooth agenesis. This QR code is for you to have this paper if you want. And we analyzed dimensional anomalies, we analyzed topographic and eruptive anomalies, we analyzed also morphological and enamel structural anomalies. And what we find that patients that has more than 9 dental anomalies outside of the cleft area, they have 20.5 more chance to have worse outcomes. And why it's happening? Because it's not only the surgical procedures or not only the iatrogenic surgeries, but two, we have genetic pathways that could telling us that these patients have a genetic probability towards growths. We find polymorphism in MEMP2, TGF-alpha, and also in FGFR2 that are associated to morphological and enamel defects, hypodontia, and eruptive defects. And these patients have worse prognosis. So we need to pay attention. The message is paying attention in what we do and what we are done, and paying attention in what our patient and their teeth is telling us, because high number of dental anomalies may serve as a predictor for maxillofacial growth outcomes. And the last point that we need to talk is regarding the treatment in the mixed dentition. This is a point that we need to decide when, how, and which way you go. For this, we need to pay attention in oral health, because we know we have scientific evidence that the children that have cleft lip and palate, they experience more caries and periodontal disease. So taking care regarding oral health. Delay in teeth development, Dr. Figueroa telling us about this in the last day. And we find in the literature that we have many papers that show us, and this is important because in the cleft area we will decide when we will start the preparing for our velar bone graft, and not regarding the chronological age, but regarding the dental development age. The jaw discrepancy could change our decisions when we will need or what we will do. And we have many panelists telling us their protocols regarding patients with jaw discrepancy, when we will start or not. And pre-bone alveolar graft that we will have the opportunity to hear from Dr. Figueroa in a few minutes. And so I would just stay here to learn with him how to prepare and what's the keys to well prepare for alveolar bone graft. And in conclusion, we need to pay attention that we need to analyze the maxillomandibular relationship and prognosis and the mixed dentition. So when the patient in the mixed dentition, stop, taking attention, paying attention in all details, look him, do a very careful clinical examination, documentation, photos, taking care regarding these. And then you need to plan your treatment considering all these points, all these key points, that dental development, bone defect, jaw discrepancy, and oral health. Thank you.